Hello everyone, myself Evan Kumar. I am physiotherapy student. So in the series of physiotherapy subjects, we have taken one another subject of the topic is manual muscle testing, which is short form MMT. So what is that and where we can use indication, contraindication, principle, aims, limitation, grading, we all of the study in this whole video. So shall we start? So, what is manual muscle testing? Manual muscle testing is a clinical method used to assess the strength of individual muscle or muscle group based on their ability to contract against manual resistance providing by the examiner. It helps to determine muscle power, weakness, and functional ability, forming an essential part of physical examination and physiotherapy. So, ये एक set टेक्निक है जिसमें हम ग्रुप ऑफ मसल और सिंगल मसल को आइसोलेट करके मसल की पावर, इंड्योरेंस चेक कर सकते हैं by applying resistance. So it could be applying by the theraband or like a therapist resistance. So हम physical examination कर सकते हैं for like checking the power and endurance. So that is the introduction. So next part is principle of MMT. What is that? So first is isolation of muscle or muscle group to be tested. It is very useful to determination of the which muscle is like have power or endurance or like there is no power or no endurance for checking or assess. So that is the first principle of manual muscle testing. Second, stabilization of body part to prevent substitution or unwanted movement. There is any compensatory movement or there is like rhythmic seizure will be occur like a patient in the Parkinson, there is a flickering of their movement. So identifying which nerve will be involved or which muscle is not will be performing well. So in which region of the body part. So that is helping to identify of them. And also after the identification, we can provide the therapeutic exercises to the patient. Third principle is proper positioning. Show the muscle is working against gravity or resistance as needed. Proper positioning of the patient for identifying the muscle or group of muscle for identifying the weakness or also isolate which muscle is not performing well. Also, we can implement on the muscle for different exercises of therapeutic or their regain or like enhance their endurance or power generation of the muscle. So that is the proper positioning. Application of resistance at the distal end of the segment in the line of the pull of the muscle. So we have like weakness of biceps muscle. So we can apply the distal part for the resistance to strengthen our like biceps muscle. There is a technique of PNF. We have like hold relax. So what is that? So we can strengthen the like weaker muscle for like contract relax technique of PNF. So where we have to apply resistance of the distal segment and their power of the like biceps muscle. Take example biceps muscle weakness. So we can apply the resistance. Patient have to apply the contraction. We can apply resistance. So like agonist or like synergistic movement will be occurs. So it will be developed endurance or power of the muscle. Fifth one is observation and palpation to assess muscle contraction. What muscle will be muscle will be activated, functioning, overactivated, or like hyperactivated, or under control activated. So all of the things will be identifying. We will Oxford or Levitt scale of manual muscle testing grading. So we have observe and palpate to touches over the screen over there. Grading of muscle strength using a standard numerical scale which is 0 to 5 scale numerical which is MMT grading. We are studying the further in video. There is another part which is the aims of manual muscle testing. What is that? Why you can apply the aims of manual muscle testing to evaluate muscle strength and detect weakness. So like for checking muscle strength has been occur or not, like if there is any kind of difficulty or like weakness, so we can use some therapeutic exercises to regain their strength or power. To localize lesion, nerve injury or muscle pathology, we can identify which muscle is exactly not working for their innervated or denervated nerve fiber. Also, we can like identify which nerve palsy will be occur over there. So if there is like a musculocutaneous nerve like palsy over there, so with like biceps muscle or like some deltoid region of muscle will not occur. So we can strengthen over there to contract, relax, hold, relax for the therapeutic exercises of PNF to regenerate all of the power of the biceps and anterior deltoid somehow. And also we can identify the nerve lesion palsy over there. To assess progress in rehabilitation or after the treatment, we can like different technique, therapeutic exercise, strengthening techniques, PNF techniques applying over there to strengthen the weaker muscle, to re-innervating of the denervated muscle. So assess the prognosis of the patient day by day for the rehabilitation. To plan exercise program and select appropriate resistive exercise. we have like plan according to the patient disability or like disorder. If like patient is like a weakness or like paralysis, so we have like different approach to different patient on their like disability. If their patient have suffering from muscle weakness, so some endurance activity, some power activity, some resistance activity to regain their power. If their patient have like paralysis, so we have like different PNF approach or different technique of the PNF rehabilitation techniques or like some electrotherapy modality to muscle re-education for the appropriate resistance applying over there, or for muscle regain their power or like endurance over there. To compare bilateral muscle performance, so if compare about that, yeah, take example where is one hand of biceps and another hand or left hand of biceps, so hand of the biceps, we are checking both of them 0 to 5 bleeding, applying resistance during the gravity, flicker, no contraction. To compare with both of them will be exact or not, will be same or not, both of the muscle will be working or not over there. So we are checking and comparing both of the muscle bilaterally performance. Next is indication of manual muscle testing, where we have to check or assess the manual muscle testing. So first is muscular disorder, for example like polio or neuropathy. If patient is suffering from polio, so we have to assess or checking manual muscle testing over there, like any and polio or neuropathy. Musculoskeletal injury like fracture, sprain or atrophy. If any kind of fracture in bonies part, or like any kind of sprain in ligament, or like any kind of atrophy, muscle wasting, so we have to check manual muscle testing over there. So muscle will be performing adequate level of like flexion, extension, internal external rotation on that or not. Post surgery orthopedic or neurological, if total knee replacement, total hip replacement, partial or hip or knee replacement, we have to check over there like rotator cuff muscle, abductor muscle, extensor muscle, flexor muscle is performing after this surgery on adequate level or not. So that time we can check or indicate, it is indication for checking the manual muscle testing over there. Functional assessment before and after physiotherapy treatment. If patient came, there is any weakness, we have to work to check manual muscle testing. If person gave endurance or power on that muscle, so after that we can compare both of the muscle bilaterally for their performance, and it is like basic approach of the physiotherapy treatment. So next part is limitation of manual muscle testing, like where we cannot achieve and not check to manual muscle testing. So what is that? Not accurate for the patient with spasticity or contracture. If any kind of patient who suffers from like cerebral palsy or like any kind of contracture or spasticity, so there is no any kind of not means to check over there like manual muscle testing, because there is also have like contracture over there. So I have to know, there is a waste of time to checking over there manual muscle testing, because there is already have there some contracture or spasticities, for there is no mean to check over there. Children under 5 years may not follow instruction properly. There is an uncooperative patient, or like there is no supportive for like we have like told them to move their hand, that so there is no any kind of movement performing. There is uncooperative patient, so there is no any performance checking on their patient. If there is any kind of suffering from delayed milestone, so we can apply the PNF technique and different exercise activity to rehab them, for there is no any kind of think about that too much to please perform to manual muscle testing. So no, that is the waste of time. So there is no any kind of thing too much on the checking manual muscle testing on the children under 5 year of age. Subjective depends on the examiner skill and patient effort. So it depends subjective data of the examiner skill. So if the therapist is new and it is not appropriate to identify the deeper muscle or like some accessory muscle to check there is have some endurance or power will be happen or not, so it will be like waste of time to told them to check the MMT over the patient. So it will be waste of the time. No, you have experience, you have like too much experience to you can go for check on that place for manual muscle testing for the patient. If you have no any kind of proper knowledge or experience, so you have like waste of time to try to patient for doing this activity or that activity, for it is a waste of the time of the you and also the patient. Not suitable for patient with pain, paralysis or severe fatigue. One of the patient who came and there is a paralysis or with severe pain or like severe fatigue, so it is a waste of time to check MMT. Either you can apply the cold pack, you can apply the PNF technique over the patient, so that activity you can there, rather than you can go for the checking MMT technique, so it is a waste of time also. Cannot measure endurance or very strong muscle quantitatively. So like it is qualitative for those muscle who have like strong action or like endurance, and we have like deeper muscle, it is a bad for that for checking the their endurance and power. So there is like lacking of the that factor for checking individualized muscle action, rather than you have like a group of muscle or like a single muscle. So our next part is manual muscle grading system, Oxford or Lovetti scale. So first is grade, description, and observation. So there is a Oxford scale. 0, so no contraction. Grade 1, press, flicker or palpable contraction. 2, poor, full range of motion in gravity eliminated position. 3, fair, full range of motion against gravity, no resistance. 4, good, full range of motion against gravity and moderate resistance. 5, normal, full range of motion, gravity and strong resistance. So that is the Oxford grading for checking the manual muscle testing. Next is technique of MMT. So there is a two technique for identified either single muscle or testing, like a group of muscle testing. So first, group muscle testing. It is used to combine action for several muscle producing a specific movement. So like we can perform flexion extension or like different kind of other activity to checking group of muscle activities, or for like checking group of muscle like have endurance or power over there or not. The therapist position the limb for the movement, applies resistance opposite the movement, directs example testing shoulder abductor, deltoid supinators together. So we can checking rotator cuff muscle will be working perform as well or not. But like we can apply all of the direction resistance over there. So for the checking group of muscle testing. Individual muscle testing or like single muscle testing used when precise identification of weak or paralyzed muscle is required. If like single muscle is paralyzed, for identifying which muscle is paralyzed, for like measuring the data, or like we can like different approach. So we can told the patient like doing this activity for like identifying the deep muscle or like individualized muscle is working or not. So muscle is placed in the optimal position for isolation and resistance is applied along the muscle line of the pull. So we can checking the muscle like activity or functioning or endurance have not. So we can apply some resistance over there for stretches came in our over the muscle for individualized muscle, and if they can hold for our resistance, so we can check the grading like muscle will be performing have like adequate endurance or power of the having or not. So requires detailed anatomical knowledge the full body for individualized muscle testing. So that is the technique of MMT. That is the first part. Thank you.